Michael Pass. I'm a family physician and board certified in family practice and hospice and palliative medicine. We started quite a while ago. By the fall of '84, we took our first hospice volunteers and trained them. The first hospice in the country had just started in '71 in Connecticut. It had been all in Europe and England before that. At that time, everybody was volunteer. There was no paid staff at all. And we had a little stone house in Clyde that we worked out of, and just had a couple of patients at a time. Usually it was the most. It was pretty small and low-key. But it was good. I got addicted pretty quickly to working with hospice, and it's very, very positive people that work with hospice. But when we started having more patients, we started thinking more seriously about needing to have a inpatient hospice facility, and worked for years with little donations and businesses making bigger donations, and then some grants gradually, and then finally got a lot of support from the hospital foundation to help raise money. The golf galas for several years, some of the money went to help fund the hospice program, and then we got it built, and finally were able to start seeing patients here a couple of years ago. I can't see anything but positive and growth for the future of this hospice program. We have a very good base of nurses, and have always had an excellent base of volunteers out in the community. And a lot of people don't like to talk about death, don't like to talk about the end stage of the illness, but if they feel like the person's getting sicker and not benefiting from their treatment, then we can do a hospice consult anytime to help them evaluate the situation and help them decide if that's the right thing. When they're in the hospitals, we do have palliative care practitioners that see the patients and families and help them weigh the benefits and risks of going with aggressive care versus the risks and benefits of going with palliative or comfort care. So that helps make the decision start progressing. And sometimes palliative care will see people on 3 or 4 admissions in a row because the family can't decide and they're not ready, and then finally they realize, yeah, this is going nowhere, so it's maybe time to go ahead and change over to hospice comfort care, trying to get the best quality instead of trying to extend with aggressive treatments. The hospice Homestead has various functions in how we do things. In some patients, it's strictly because symptoms are out of control at home or in the hospital, and they're not really able to get things adjusted. So we bring patients into the homestead and adjust medications, get the comfort level down, get the family comfortable with taking care of the symptoms, and then they go home. And hospice goes home with them and helps take care of them there. If they aren't able to take care of them at home, that same person can go to nursing home and hospice follows them there. So it's just an additional service, kind of wherever they are. But there are other ways that it's used. Some people get to the very end of life and the family really can't handle things, or have really been afraid of the patient dying at home, or they've just been caregiving too long and they're exhausted. So we can bring them in for end-of-life care and adjust the medicines and try and make things as comfortable as possible for both patient and family. The other service we offer is just called respite level of care, and it doesn't require that they're particularly sick. They're just appropriate for hospice, and the family, in some cases, just needs time to get equipment in the home and get ready, but it's just a time for rest for the family to take a break while we take care of the patient. And I decided kind of in the middle of college to go into medicine. I've been in sociology because it made me pick something, and realized after I figured out what that was not what I wanted to do. And I'd had a terrible experience in high school as far as the sciences, so I kind of tried to steer away from some of that, but had to take some sciences. And one of my professors who said, you need to go into the sciences, you need to do something there. So looked more into it, made straight A's in biology, loved it, and started thinking about my options. At that time I was taking social work classes thinking I might change in that direction because I knew I wanted to help people, I just wasn't sure how. So once it clicked, I decided to go into pre-med and had a tremendous peace about it and never thought about it again.
My name is Teresa Nelson, and the reason that I started in healthcare, I had had many different jobs in my life, and I finally decided it was time for me to do something that I wanted to do, and what I wanted to do in my heart was help people, and that's what I feel like that I do here. Some of the good things that I have to say about the Homestead, if someone is looking for a place for their loved one to come to, is that one thing, I'm a native Haywood County girl, and I've been here all my life. It's convenient for everyone, and especially for our older generation that finds it hard to drive in the big cities. And the staff here is just wonderful. All the patients get excellent care around the clock, 24 hours a day. And I think it's just wonderful that Haywood County has the Homestead.
Healthcare. My name is Samantha. I chose to work in healthcare because it's an honor to be able to provide a service that people don't always know that they're going to need or don't understand what goes into it until they're involved either in their own health or their family member's health, and to be able to go that journey with people and be that personable and that having that touch that you can provide care for is something special not everybody gets to experience. So I feel very privileged and honored to be able to do that. Hospice kind of found me. I didn't find hospice. It was like an interesting journey for me, and one that I've been very, very happy to partake. You get a very warm welcome no matter who you are when you walk in the doors, and you're immediately treated like family, and that is a fantastic place to be able to work every day. So, if I had to say anything to anyone who was planning to come to the Homestead, it would have to be that you could find no better place to have a loved one go through the journey and the process of dying in a more caring and compassionate place, and it sets itself apart in that way. And the volunteers at hospice make a huge impact. They are pretty much the behind the scenes kind of people and the front action people that are interacting with patients and family as they walk through the door. They're helping nursing staff and clerical staff, chaplain services, bereavement services. They're amazing in what they do. Little touches. We have volunteer staff that make teddy bears for patients and families. And that's a touch that is wonderful that we have, and we're very fortunate and thankful for our volunteers.